Hey there, Katie here from Front Porch Nurse, and today's video is about home health versus home care. Are they the same? And just to ease your mind, no, they are not. I'm sure you had this as a burning question. But it's important to understand home health versus home care if you have aging parents or loved ones. So let's talk about it. The way that I am organizing these videos, so you know, is I'm going to try to go through, remember middle school English, who, what, when, where, why, and sometimes how. That's what I'm going to go through to define the differences in topics, so home health versus home care, and then I'll dig into the details a little bit. So, home health, who the home health providers are healthcare professionals who are licensed, like registered nurses, licensed physical therapists, etc. What is providing specific skilled medical services in the home to oh the neighbor dog's coming out. Providing medical services in the home for a specific reason. Home health has to be ordered by a provider. When is usually after surgery or hospitalization, or it could be if there's a new diagnosis or a change in the patient's condition, like maybe they went to a doctor's appointment and they were noticeably weaker. Then home health physical therapy might be one of the things that they do. Or they get a new diabetes diagnosis and need to learn how to check their blood sugar. Or they come home from the hospital and had surgery. Maybe they got a new hip and they need somebody, a nurse, to come out, check the surgical incision, make sure everything's okay, and then physical therapy to get back on their both feet. Where is in the home and why is really, I kind of covered that. So if there's a change in condition or if there was a hospitalization, just any medical change, this is also home health is part of the healthcare system, part of our medical system in the US. It may not seem like it because everything is really disjointed for us, but it is technically part of the system. Okay, home care. I don't know why they name these things so similar. It's so annoying, like so many things in healthcare. But home care is usually provided through an agency. It is provided by people who are not necessarily licensed. They may have certified nursing assistants employed, and those people are licensed. But as a home care caregiver, they're not practicing licensed work. They're practicing under this, it's considered non-skilled. So like they assist the elderly person, but they don't actually have a license to do any medical care. Um, it is a private pay situation, which means the patient pays the agency out of pocket. Nobody wants to hear that. If you have not been exposed much to aging care in the US, a lot of it is private pay. We can talk about that more. If you have questions, let me know. When is whenever the patient needs help, the client. If if you notice, say that maybe your mom lives alone and she doesn't seem to be as able to like get dressed by herself as she could. Like she struggles. It takes her a long time. Or maybe she has a harder time now putting together lunch, whatever, or getting to appointments. So those are the kinds of things that a home caregiver can help with. When is whenever, yeah, whenever it's needed, whenever you want to hire someone or whenever your parent lets you hire someone. Where is at home? And why is to assist, is to support. Like if you can't be there all the time, maybe you work outside of the home or whatever, or maybe you live in another geography than your parents. That's super common. That's why there are home care agencies, and usually the agencies are licensed and bonded. That's one thing to ask when you're hiring. Of course, getting a licensed and bonded agency is a little bit more expensive than just hiring somebody off of whatever, Craigslist, but it's also safer. Um, Generally, it depends on the agency, it depends on your geographical location, and it depends on like how many hours you're hiring for. But home care can range from 20 to 40 plus minus dollars per hour. Usually it's in that 30 range where I live, but it can range from that 25 to 40 an hour. So that's a big range and it does add up, but it's a lot less expensive to have somebody come in for a few hours, say, than maybe you moving across the country to do that. So it just depends on the level of support that's needed. So, home health, medical, these people do not stay in the home. That is a myth. They come in for their hour, they do what they're supposed to do, whether it is teach blood sugar checks or administer IV medication or check the surgical wound, then they go out. The hospitals a lot of times will, I don't know why, but they perpetrate this myth that home health, these licensed professionals will come in and just stay there. They won't. This is covered by Medicare or insurance. Depending, Medicare usually covers fully 100%, but insurance, it just depends on your insurance, how much they cover. I think that is it. If you have questions, please post below. I will answer. And is your curiosity so satisfied now that you know this? It's good to know. It's usually the starting point. Home health is oftentimes the starting point of our aging parents kind of getting on that medical merry-go-round. So beware. All right. Come on over to my website, frontporchnurse.com. Sign up for the email newsletter. The link is in the description below. And see you